Hi everyone, it's Danner. I will be presenting to you task 3 of HNN120, and I will talk more about Peter's case. In this presentation, I will be discussing to you the importance of interdisciplinary team, two other healthcare professionals mainly involved in his recovery, role of the primary nurse, using of clear communications, and my reflection on this case study as a whole. Interdisciplinary team is a group of healthcare professionals with different areas of specialization working together to achieve their patient's ultimate objective. This approach is usually needed as a requirement for assessing and managing conditions involving complicated psychiatric comorbidities and psychosocial circumstances. Since a group of healthcare professionals are present in the assessment, the care and treatment of the patients more likely become swift and precise. This approach can also improve the patient's condition because of the combined efforts of the healthcare professionals. It helps avoid risk against benefits for the patient. The team consists of the client family or caregiver, medical and mental health providers, nursing staff, social worker, and rehabilitation therapies, and etc. The composition of people can vary depending on the situation. Once an assessment has been made, the expert may then match the patient and pair them with a more appropriate team who can alleviate his current condition. In this situation, where it involves elder care, this approach is advantageous since it generally requires multiple demands. Given their condition, and they usually require a number of diagnoses, which entails complex needs. In Peter's case, since he was involved in a motorbike accident, we can create a trauma team which is composed of a surgeon and physiotherapists. We need a specific healthcare professionals that will focus on his condition. Since he sustained a bruised ribs and a fractured left humerus, a surgery must be done. Once the operation is successful, and aftercare shall be responsibility of the therapist to help him improve his situation. The team leader should be the surgeon because he knows where the injury is and will be responsible for the pre and post care of the patient. He will also guide other members of the team on how to handle patients, not only his physical health but also his mental health. This team created for Peter will be responsible for his condition from assessment to rehabilitation. Nurses' role in the patient care have always been non-negotiable because their skills and knowledge are required for the patient's condition to improve. A nurse can recognize a patient's case that will help the members of the interdisciplinary team achieve their aim of providing a safe and quick recovery for the patient. Nurses are the frontliners to any diseases or illnesses, initiating patient interaction by asking pertinent questions to determine which therapy is best for the patient and probing questions to assess the patient's current health status. Because of their outstanding communication skills, nurses are team players. These healthcare workers see a lot of patients every day and rely on the nurse's chart for information. Nurses are the only clinical healthcare professionals who are skilled to comprehend the responsibility of other healthcare providers, which builds a strong foundation for a successful collaboration. Their ability to communicate with patients and relay the information to a specialist is not something that one should take lightly. That is why nurses are as important as the healthcare providers who are treating the patients with their condition. In this case, the initial care and assessment of Peter was made by a nurse before it was actually referred to a specialist. Information of this patient was gathered by the nurse during the assessment phase, which is part of the nursing process. These are important and relevant questions that can make a big impact on the patient's case. There is also a need for the nurse to relate any pre-existing conditions such as history of high blood pressure, diabetes, and etc., and ask if the patient is taking any maintenance medication. This is to ensure that the medication prescribed by the attending physician will not interfere or have a bad effect on the patient. Logical, precise, and prompt communication is needed for a superb healthcare and is strongly likened to healthcare staff for job satisfaction. As discussed in my previous answers, effective communication plays an important role in patients' recovery. Healthcare professionals rely on their assessments and care plan based on the information acquired from the time the patient was admitted until the patient was given the proper care. The nurse's role is not limited to understanding the role of the healthcare provider and effectively communicating with the patient. They are also responsible for the continuance of care and updating the patient's daily condition until he has fully recovered. Patient safety experts concur that communication and teamwork are necessary in providing quality health care. It can ameliorate patients' outcomes, errors, and mistakes that can be critical to the patient's condition. Through clear and unequivocal information, professionals will be able to provide detailed and precise assessments, which can contribute to the advancements of the patient's condition and lessen the possibility of morbidity. Although an initial assessment may not always lead to accurate diagnosis, since they need to conduct lab tests to determine the causes, initial interactions made by nurses to the patients are the first steps in identifying what course of action is needed. The information is then being shared to the provider for them to act upon it. It is rare for the patient to be handled by only one provider. That is why an interdisciplinary team of healthcare professionals deliver care, and nurses need to help have the proper preparation and be equipped with skills to work as part of the team. That said, nurses are responsible for filtering a complicated case, simplifying it, and assisting providers to alleviate the patient's physical and mental health condition. In this case, Peter, any changes that transpires from the start of your shift until the end should be documented. If there are relevant changes on the day prior to your scheduled care of the patient, it should be reflected and documented on paper. Although word of mouth can be more convenient, it is critical that the same information is written down to ascertain the veracity of the information passed on to you. Collaboration is very important in providing safe and quality healthcare. An interdisciplinary communication approach has high satisfactory results in patient care. Through this, healthcare professionals are not burdened with the work because it is being divided among them. As I have ventured through this study, I have learned that nurses' role is very flexible and versatile, and that other healthcare professionals rely on our skills not only in actual patient care, but most especially in communicating effectively with them. Teamwork indeed makes the dream work. Most careers are not a one-man job, but it's hits differently once you are in a healthcare setting. The work we do is very complex, and one decision can make or break and affect the life of our patient. It is not easy, especially one tiny mistake could be the cause of a further damage or result in death. Learning about interdisciplinary as an idea and approach makes you recognize what is lacking with most methods that often leads to failure. It is significantly important to communicate effectively, not just merely communicating, but to do it with accuracy and with all the facts verified. Communication is the key to understanding an ordeal, not only in healthcare, but also in other aspects. This case study made me realize that my role as a nurse is the deal breaker in influencing providers' care to the care plan of the patient. As a student, I will be more vigilant with my actions and will conduct more research on how to be effective communicating with these people. These studies have been tested by experts and have been proven to be effective based on the real experiences. As someone who is about to take the road, I must equip myself with this knowledge so that I can become qualified for the job. That said, I challenge myself to enhance my skills and capabilities and not rely on my current state. I would impose upon myself an attitude that would help me become a team player so that our providers will come up with a swift and convenient assessments. It would be an honor on my part to be a great contributor to the speedy recovery of the patient. I will need to improve my relationship with my fellow healthcare professionals since I will be working closely with them. I learned that whatever role we have in this industry, it is important to keep an open mind and learn from each other. I should not only rely on my own strengths, but also trust my provider's discretion. As a professional, it is my responsibility to promote trust and confidence so that our patients will simply entrust their health to us. If they trust us with their health, they will feel more secure and disclose information that could possibly direct to us a more accurate diagnosis. And this is the end of my presentation. Thank you so much.